Ramsey County Board of Commissioners. Roll call, please.
Jabin Singh,
Here.
McGuire,
Here.
McMurtry, Miller,
Here.
Moran,
Here.
Zhang,
Here.
and Ortega.
Aye. Stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'll entertain a motion on the agenda of March 11th, 2025.
So moved. Should do the land acknowledgement. Second.
Roll call.
McGuire,
Aye.
McMurtry,
Aye.
Miller,
Aye.
Moran, Zhang,
Aye.
Jabin Singh,
Aye.
and Ortega.
Aye. I missed the land acknowledgement, so can we go to that, please?
Yes, Mr. Chair,
Mary
I'm
Jo?
honored to read our land acknowledgement on behalf of the board. Every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will. Some were drawn to leave their distant homes in hope of a better life. And some have lived on this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We are standing on the ancestral lands of the Dakota people. We want to acknowledge the Ojibwe, the Ho-Chunk, and the other nations of people who also called this place home. We pay respects to their elders, past and present. Please take a moment to consider the treaties made by the tribal nations that entitle non-Native people to live and work on traditional Native lands. Consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events.
Thank you, Commissioner McGuire. Now, could we go to the minutes of February 18th, 2025?
So, second.
Hearing no discussion, roll call.
McGuire,
Aye.
McMurtry,
Aye.
Miller,
Aye.
Moran, Zhang,
Aye.
Jabin Singh,
Aye.
and Ortega. Commissioner Ortega?
Aye. I'm sorry, I'm multitasking up here. We welcome our new commissioner, Garrison. We are waiting. We have, I believe, Judge Castro on the way down. I don't know what the mix-up was, but we get started pretty soon. We welcome you, and Garrison was with us. He was already officially sworn in, so he got to go with us to Washington, to the legislative conference, and meet with our representatives and talk about our issues. And we welcome you, and we're looking forward to working with you.
Can't wait.
Should we take the policy items and then come to, why don't we take the policy
I'm
items?
happy to
Yeah.
do that, Mr. Chair. I'm going to move item number 4, the amendment of appointments to standing committees for 2025. I'd like to move amendment 5, policy item 5, amendment of appointments to outside boards and committees for 2025. Item number 6, appointment to the Ramsey County Housing and Redevelopment Authority for 2025. Item number 7, appointment to the Ramsey County Regional Rail Authority for 2025. And then I do the administrative items. Would you like me to do those as well?
Why don't we take these all in
Yeah, and then we'll
blocks?
vote on those, yeah.
Need a motion? I'll make that motion.
Well, you moved the
Oh,
second.
yeah, second, yeah.
Second.
Sorry, I'll move those. I'll move those, then you second.
Hearing no discussion, roll call.
McGuire,
Mr. Chair.
I just have I think there's just an error in one of the appointments to the standing committees.
Okay,
It has myself listed for the AMC Board of Directors, and then on the second one, it appoints Commissioner McMurtry.
yeah.
So just for consistency, it should just be Commissioner McMurtry
Right.
as Board of Directors.
And are you the alternate?
Yep, I'm the alternate.
Okay, so we could correct that
Yeah.
as Mei Shun is the alternate?
Commissioners, County Manager Becker, the correction was made last Thursday.
Oh, okay.
And we republished it a second time.
Okay,
So the appointments to AMC is correct with Commissioner McMurtry as the representative and then you as the alternate.
Okay, sounds good, thank you.
Thank you for pointing that out. Hearing no further discussion, roll call.
McGuire,
Aye.
McMurtry,
Aye.
Miller,
Aye.
Moran, Zhang,
Aye.
Jebin Singh,
Aye.
and Ortega.
Aye. There we
And
go.
then, thank you, Mr. Chair. I would like to move the following administrative items. Item number 8, license for bicycle path pedestrian walkway with Burlington Northern Santa Fe LLC for the Phase 1 Bruce Vento Regional Trail section. Item number 9, conveyance of Owasso Boulevard right-of-way parcels to the city of Shoreview. I move item 10, request for proposals for micro market services. I'd like to move item 11, appointment of Ramsey County Auditor and Ramsey County Treasurer.
I'd like to pull that item, Mr. Chair.
Yes. Pulling item 11. I move item 12, terms of collective bargaining agreement with law enforcement, labor services, local 353, emergency communications, shift supervisors for the years 2025, 2026, and 2027. Thank you, Mr. Chair.
Okay. Well, let's vote on this first.
Okay. And we need a second.
A second.
Any further discussion on the items? Hearing none, roll call.
McGuire,
Aye.
McMurtry,
Aye.
Miller,
Aye.
Moran, Zhang,
Aye.
Jebin Singh,
Aye.
and Ortega.
Aye. Garrison?
Thank you, Mr. Chair. I'm hoping that County Manager Becker can kind of explain to us a little bit more about the Ramsey County Auditor and the Treasurer and maybe introduce us to the folks who will be taking on these roles.
Yeah, good morning, everyone. Mr. Chair, Commissioner McMurtry, and Commissioners. This RBA is the final step to what has been a fairly long process in decoupling the treasurer and auditor roles in the county. The Information and Public Records Service team conducted a study to review how other entities manage this work, and it recommended that we would transfer the functions of the treasurer over to our finance department. So the IPR Deputy County Manager, Karen Francois, and our CFO, Alice Kutza, supported this recommendation, and this transition actually happened as part of our 24-25 budget, becoming effective January 1st of last year. Since then, finance has been handling the treasurer responsibilities. Today, we're just completing the final step to align with state statute and reflect these changes. This includes formally appointing Jeanette Bolt-Canina as treasurer and also reflecting Tracy West as auditor. So I'd love for both of them to come up and just quickly introduce themselves to all of you. I think they're both here.
Welcome.
Good morning. Chair, Commissioners, my name is Tracy West.
Good morning, Board Chair
Good morning.
and Commissioners, and good morning, County Manager Becker. My name is Jeanette Boyd-Kania, officially appointed as the Treasurer of Ramsey County. And I just want to take 1 minute to introduce the Treasury team, the very important team that was created about a year ago. If you would allow me, I'd like them to stand, and you can recognize them. So I'd like my team to come. I asked them if they would show up today, and they all showed up.
Yay.
So if you would all stand, just stand and
Well,
to be
why don't you
recognized.
come forward?
Awesome. Sorry.
Since you're here, we can take a good look at you.
So as County Manager Becker said, this team was created at the beginning of 2024. We started off as a 2-team member and exploded into about a 7-team member called the Treasury Team. We do very important functions for the county: cash management, investments, bond issuance, and it's really been a long year of putting processes and procedures in place, making sure that we're very good stewards for the property taxpayers of Ramsey County. So with that, I'd like to accept the position and do due diligence in doing what we need to do to support the residents of Ramsey County. Thank you.
Well, welcome, very.
You can introduce yourself.
You want to, on the way? You want to introduce yourselves on the way out, please?
Hi, my name is Linda Sutton, and I manage the debt investment and the bonds.
I am Donald Strelo. I am part of the finance in regards to the receiving area.
Good morning, Board of Commissioners. I'm Sukeshi. I'm part of the Treasury team. Thank you.
Hello, my name is Joe Gonzalez. I'm admin assistant to Jeanette Burkania.
Good morning, Rebecca Hansen. Nice to meet you.
My name is Prompon King. I'm doing bank reconciliation.
Thank you so much. I just want to say I'm a very proud immigrant, first immigration immigrant from Kenya, and my journey has been long, and I call Minnesota my home, where I have raised my 2 beautiful children. Thank you.
Thank you.
I just wanted to add one thing. So we have an election going on right now, so the election team is busy working hard on the election for 40B, and then the tax team, which the county auditor is also responsible for, is busy calculating taxes right now. So I just wanted to thank the team for their hard work as well. But thank you, and I appreciate the point.
Well, thank you for your good work. You want to move it, Garrison?
Sure. Move item 11, appointment of Ramsey County Auditor and Ramsey County Treasurer.
Second.
Hearing no, oh, go ahead, Marcia. Go
It
ahead.
doesn't pertain to this.
Oh, hearing no further discussion, roll call.
McGuire,
Aye.
McMurtry,
Aye.
Miller,
Aye.
Moran, Zhang,
Aye.
Jebin Singh,
Aye.
and Ortega.
Aye. We are now ready.
Oh, Mr. Chair?
Yes.
May I actually pull item number 12? There is an error in the attachment.
Yeah, I'm going to call up our Labor Relations Manager, Cassie Fagoli, to address that.
Yes. Yeah, but we need a second.
Yeah.
May I get a second, please?
Second.
Good morning, Commissioners. It appears to be an error in the tentative agreement summary that we attached within the RBA for the LELS supervisors. It should actually read it's a 3% increase effective the first full pay period of January 2025, 3.5% increase the first full pay period of January 2026, and a 4.5% increase the first full pay period following January 1, 2027. I think we probably used an old template in order to create that document and missed that year.
Mr. Chair, I would like to amend that to reflect those following changes.
Second.
Okay. We'll take a vote on the amendment. Is that correct?
Oh, okay.
Okay.
I'll make a motion to reconsider item
12.
12.
Okay, thank you.
I'll second that motion to reconsider,
Okay.
and then we have to
Then we
vote
go
on,
to
do we have
the
to vote on the
amendment.
reconsideration first? Yeah.
Yeah.
Then we have to vote on the amendment. Okay, so let's.
Roll call.
McGuire,
Aye.
McMurtry,
Aye.
Miller,
Aye.
Moran,
Aye.
Zhang,
Aye.
Jebin Singh,
Aye.
and Ortega.
Aye. We'll now take, my turn. You want to move the amendment?
Yes, I will
I
move.
mean, the item.
I'd like to move item 13.
12?
Oh, 12? I'm sorry, I lost my place on the agenda here.
Yeah, you want to move item 12, yeah.
Okay, that's great. Yeah, I'd like to move item number 12.
With the amendment, as amended. As amended. Right? She wants to move item number 12 as amended.
Yes. I would like to move item number 12 as amended.
Second. The year.
Any further discussion? Roll call.
McGuire,
Aye.
McMurtry,
Aye.
Miller,
Aye.
Moran,
Aye.
Zhang,
Aye.
Jebin Singh,
Aye.
and Ortega.
Aye. Thank you very much.
Thank
We
you.
appreciate it.
Thank you.
The big moment is here, Garrison. We have Judge Castro. Thank you for taking the time to come down here. Do we have the
my
family?
family come
Yes.
up and any other community members, Matthew, Noah, get on up here. Yeah, that's-
Maybe Garrison to be in the middle.
Huh?
Garrison in the middle. I don't know.
I think that's okay.
It's okay.
I think we're good.
Please raise your right hand and repeat after me. I, Garrison McMurtry,
I, Garrison McMurtry,
do solemnly swear
do solemnly swear
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the State of Minnesota,
and the Constitution of the State of Minnesota,
and that I will faithfully and impartially
and that I will faithfully and impartially
exercise and discharge
exercise and discharge
the duties of the position of Ramsey County Commissioner,
the duties of the position of Ramsey County Commissioner,
to which I have been elected,
to which I have been elected,
to the best of my ability and understanding.
to the best of my ability and understanding.
Congratulations. Thank you.
Thank you, Judge Castro.
Thank you, Judge.
It's on call.
Well, we're finally here. I want to start by thanking a few folks. First, a big thank you to my family, both those who are here today and, of course, those back in my home state who are watching online. A special thank you to my amazing wife and my favorite state senator. For her continued love and support throughout all of this and life. Next, I want to thank our former District 3 Commissioner, Trista Martinson, for her service to our community and unwavering commitment to building a sustainable future for our county. Finally, I just want to thank the residents of District 3 for bestowing upon me this honor to represent our community on the county board. Now, for those of you who may not be aware, my journey into this moment started back in Canton, Mississippi, where I was born and raised by my mother, my grandmother, and my aunt, three incredible black women whose strength and wisdom and dedication to justice shaped who I am today. From them, I learned the power of community service, the importance of truly listening to others, and the need for active engagement in our civic duties. Now, to no surprise, growing up in Mississippi also meant that I grew up in the church. And I remember the book of Isaiah, which teaches us to learn to do right, to seek justice, and defend the oppressed. This teaching continues to speak to me and honestly serves as my North Star as I take on this new role. That passage from the book of Isaiah also serves as a reminder of what we must continue to fight for as forces on the national level work to destroy the fabric of who we are and what we believe. These forces want to cut Medicaid, which serves our most vulnerable communities. These forces think that it's okay to arrest our immigrant neighbors, whether they're undocumented or not, and leave communities fearful of going to school, the grocery store, or even calling for help when they're in need. These forces want us to believe that the high prices of food isn't because of the trade wars that they started, but instead a result of diversity, equity, and inclusion. They want us to fear each other. When I look around this room, though, I see something different. I see community. I see people from all walks of life who are committed to building a county where everyone has the opportunity to thrive, whether that's through job training or affordable housing, better public safety, or creating a sustainable economy. I also see a community that said that the absence of my perspective and lived experience as a Black man, which has never been present on a county board in the history of the state, will see that absence officially end today. I am forever grateful for this trust in me and in this opportunity. The work ahead of us won't be easy, but it will be necessary. I'm proud to come from a people who know a thing or two about hard work. I'm here because of the giants that came before me, Fannie Lou Hamer, Medgar Evers, and John Lewis, as well as those giants right here at home who've paved the way for this moment, Josie Johnson, Debbie Montgomery, Tony Carter. So I'm truly honored to be here. I'm honored to take on this role, and I'm ready to work alongside each and every one of you to build a community for future generations. Thank you all so much. Should we just stay here? Okay.
Need everybody in between the goals. Sorry to come in. Oh, yes, perfect. Everyone's good? All right. There's a couple in here. Graham, all right. 1, 2, 3. 1, 2, 3. Do a couple more. 1, 2, 3. 1, 2, 3.
Thank you.
Yeah.
Our next agenda item is a presentation regarding Aging and Disability Services and MinChoices Division. I'm going to ask Katie
And Sophia Thompson.
and Sophia. Where do I have?
And Katie.
I left you out, Sophia.
That's okay. I still show up.
That's
why we love you.
Yeah.
Good morning. I just wanted to kick us off this morning before we do the presentation. So, Mr. Chair, Commissioners, County Manager Becker, thank you for allowing the Social Services Department to come before you this morning to share with you about our MinChoices and Adult Services Division. It is a division within our Social Services Department. Timeliness of MinChoices assessments supports the county's priority of residents first, effective, efficient, and accessible operations. Since last year, the county has been actively driving the All Hands on Deck initiative to tackle persistent backlogs in public assistance programs. You all are very aware of All Hands on Deck. These efforts have been focused on financial assistance services, the Financial Assistance Services Department, which administers critical programs like SNAP, medical assistance, and cash assistance, led by Director Ali. In social services, today's presentation addresses our commitment to reducing delays in MinChoices assessments. To date, there are significant backlogs, which many of you are aware of because you get the communications regularly. These backlogs in MinChoices, if left unattended, If left unaddressed, these challenges are expected to escalate to levels in other program areas that are primarily focused on the All Hands on Deck initiative. While not formally part of All Hands on Deck, this work aligns closely with our countywide commitment to putting residents first. This shared focus reflects our dedication to improving access, delivering timely, effective supports across all service areas. And our Deputy Director, Katie Mulneri, is going to share with you a lot of information this morning. And I'll just ask you to be patient as she gets through the breadth of the very detailed information. Katie.
Thank you, Director Thompson. Mr. Chair, Commissioners, County Manager Becker, good morning. My name is Katie Molinaire. I currently serve as a Deputy Director within our Social Services Department. I lead the Aging and Disability Services and MnChoices Division. Thank you for the opportunity to speak with you this morning about our area. As Chair Ortega mentioned, we'll be providing an overview of our division. We'll include some of the challenges that we're experiencing currently, and we'll also introduce a proposal for an upcoming request for board action. Our area provides programs designed to support the elderly and people of any age with a disability to live in the community as independently as possible. Our division has 3 units. Our MnChoices unit completes assessments that are used to determine eligibility for home and community-based services, such as waivers. A waiver is a funding stream or a pool of money that's used to pay for services and supports for an individual. They also determine eligibility for Community First Services and Supports, which you may know as Personal Care Assistance, PCA, and Consumer Support Grants, CSG. Our case management unit provides, as the name implies, provides case management services to residents who are eligible for waiver services and also other types of case management for individuals with developmental disability. Our admin and access area provides administrative work to turn services on for residents who are on a waiver, as well as for PCA and CSG, again, now known as Community First Services and Supports. This area also provides support for our contracted case management agencies. Currently, we contract out with 21 agencies in the community, and they provide about 85% of our case management on our behalf. There's also a team in this area that provides guardianship services to residents. And this is the area that leads our implementation of Community First Services and Supports. I want to note here to give you a sense of the residents that we're serving. These are individuals who either were born with or acquired a disability during their lifetime. That may be a brain injury, it may be a mental health diagnosis, it may be a developmental disability. Based on the individual's needs, they may need a little assistance or they may need quite a significant amount of assistance. That may look like assistance preparing meals, eating, personal care such as toileting and bathing, transferring. It could be environmental or home modifications. So you've heard me mention MnChoices a couple of times now. That is a web-based application or tool that is used to integrate assessment and support planning for individuals who seek access to Minnesota's long-term services and supports. It determines eligibility for the waivers. So for individuals over the age of 65, that's alternative care and elderly waiver. For individuals under the age of 65, typically, that is brain injury waiver, community alternative care waiver, which is for individuals who meet hospital level of care, community access for disability inclusion, or the CADI waiver, that is for individuals meeting nursing facility level of care, the developmental disability, or DD waiver, and again, Community First Services and Supports, which as a reminder is what used to be known as Personal Care Assistance, PCA, and CSG. A person of any age with a disability or who is in need of long-term services and supports can request a MnChoices assessment. The statute is written such that we do need to provide an assessment even if we can tell by the initial screening that they're likely not eligible. If they request it, we're still statutorily required to provide it. The services in our area are statutorily required. Minnesota Statute 256B.0911 states that a consultation must be completed within 20 working days of the request. Reassessments also must be conducted annually. In terms of our staffing, we have in the Min Choices area, that is our biggest unit within the division. We have 2 managers overseeing 11 teams, each with a supervisor. There are about 146 staff altogether, including 13 employees who are funded through ARPA. The average team size is 12 people. Within our admin and access unit, we have 1 manager overseeing 3 teams, again, each with a supervisor. There are 29 staff in this area. This includes our vendor liaisons who support our contracted case management agencies and also oversee contracts such as with our case management providers. The average team size there is about 7 people. In our case management unit, we have 1 manager overseeing 4 teams, again, each with a supervisor. There's 43 staff in this unit, and the average team size is 10 or 11 people. I want to make a note here that after in 2023, in preparation for the 24-25 budget cycle, we condensed from 5 teams to 4. So altogether, we have about 218 staff, and including our leadership, we have almost 245 people in our division. We wanted to provide some information on the number of residents that we're serving, as well as how that number has increased over time. So you can see on the left side of the slide for Min Choices, in 2023, which is the most current year that we have full data for, well, we completed over 17,380 assessments. That does include, so we're allowed to contract out PCA-only reassessments, and that does include those that are contracted out. Looking at the slide, you can see in 2017, we were serving about 12,375 people with assessment, and that number has increased to over 17,000. Initial assessments have increased by 29%. Reassessments have increased by 49% between 2017 and 2023. On the right side of the slide, you'll see case management has also increased significantly by 50%. In 2017, we were serving about 8,400 people. And in 2024, we're serving 12,640 approximately. And that does include the folks we're serving through our contracted partners. The orange line on the bottom of the screen is residents receiving Consumer Support Grant, CSG. That's about 400 people. And that's one of the programs that is converting to Community First services and supports. CSG is a monthly cash subsidy that the individual or family can use to pay to provide for services and special needs, such as respite care, adaptive aids, and homemaking. We are fortunate in our area to be able to generate revenue for the services that we provide. One of the primary sources of our revenue is called Random Moments. This is a revenue source for counties via the Social Services Time Study. This reimburses counties for administrative social service costs through a mix of state and federal funding. And we use a random moment time sampling to do that. So the employees who are eligible to participate in Random Moments will receive an email at a random date and time, and they reply selecting the code for the work that they were doing at that date and time in the email. The state takes those responses, and then they reimburse counties quarterly based on those responses. To give you a sense of the revenue that we generate, in 2024, and I want to make a note here that this is through quarter 3, quarter 4 revenue isn't available to us just yet. Through quarter 3, we generated $18.6 million in random moment revenue. In 2023, we generated $26.1 million, and in 2022, we generated $24.7 million in random moment revenue. So it's a very significant source of funding for our area. We also are able to bill for the case management services that are provided through waiver. In 2024, again, this is through quarter 3, so it doesn't include quarter 4. This is $3.3 million in revenue. In 2023, we generated $3.6 million in waiver case management revenue, and in 2022, $3.8 million in waiver revenue. Now that I've provided an overview of our division, I'd like to speak a little bit about some of the challenges that we've been experiencing. So over the past several years, going back to about 2018, there were some cost shifts to counties from the state. For our area, that meant a loss of 18 positions. There was a previous board discussion that's linked in the PowerPoint for additional information and context that was done back in 2022. Due to additional budgetary constraints in 2023 for the 24-25 budget cycle, our division lost an additional 10 positions. So that's a total of 28 positions. Meanwhile, as you see in the graphs, community need for services in our area has continued to increase. From 2017 to 2023, Ramsey County has seen over a 40% increase in the number of assessments needed by residents for home and community-based services. 40%. There's an 8% increase in the number of residents aged 65 and older, and a nearly 19% increase in the number of residents under age 65 with a disability. So the main takeaway that I want to drive home one more time is that in the context of increased community need, we have had to be in a position to reduce FTEs. In addition, last year in 2024, there were some DHS required changes that have impacted our workloads. We recently transitioned to a new MinChoices application. It's called Revised MinChoices. When they shut down the first version called MinChoices 1.0, counties were no longer able to do what's called a legacy or a paper reassessment. So for some counties, including Ramsey County, we were having case managers complete a reassessment on paper rather than having the assessment be done by a MinChoices assessor within the MinChoices application. And that was due to capacity constraints. That option was removed as of October 1st of 2024. So for us, that means that we have an additional approximately 1,000 reassessments that we need to do annually by assessors using the MinChoices application.
Excuse me, Madam Major.
Would you go back and just explain a little bit more about the legacy reassessments again? Just say it one more time, like I'm just not tracking that or on what that is.
Mr. Chair, Commissioner Zhang, absolutely. So the reassessment done by legacy is just a paper version of the assessment. So rather than having the assessment completed by a certified MinChoices assessor using the online application or tool, it was a paper form that the case manager could do when they went out to see the resident for their annual assessment. So it was a way for us to keep the capacity within MinChoices to a level that was manageable. And since we're no longer able to do that option, all of those assessments will need to be done within the MinChoices area, which just adds to the staffing challenges that we're experiencing.
One more question. So the folks who are out in the homes, they're not certified MinChoices staff?
The case managers are not certified assessors typically. There's a pretty significant onboarding training to become a certified MinChoices assessor. We have our own onboarding within our division, and then there's also a DHS required training program. We think that takes about 20 hours to do the certification just alone. So the caseloads within case management are high enough that they can also do the assessments. There's also best practice indicates that we should separate the two roles to make sure that the resident is receiving sort of an objective perspective when that assessment is completed.
Okay, great, thank you.
Absolutely. The other challenge that we encountered last year, also on October 1st of 2024, is DHS began the rollout of Community First Services and Support, CFSS. So this is a new program that provides, it's a rebranding of PCA and CSG. It provides additional flexibilities and additional ownership for the resident. So it's person-centered and it's a wonderful option for residents. There are a number of additional administrative responsibilities for counties and lead agencies. So previously staff were maybe touching a case once, now they're having to touch it 2 or 3, perhaps even 4 times. So there's just a lot of additional time and administrative pieces that go into that, which is adding to workloads. All of this combined together has pushed us into a state of crisis. Current need for services in our area far exceeds staffing capacity, and this has resulted in wait times for residents. In initial MinChoices assessment, residents are waiting nearly 8 months. That we have 1,947 residents as of March 4th who are waiting for an initial assessment. For an annual reassessment, which is statutorily required in order to keep a resident's services continuing, we're in a place now where we don't have enough staff to assign all of those reassessments. So we do have a small number of folks who have had a gap in their services. So for the resident, they may not be able to access the services, or they have a provider who is providing it and may not get to be able to be reimbursed. Or it also puts us as a county at risk. We may be asked to financially cover those costs. I'll add here too that the reason the initial assessment backlog is growing so exponentially is because we've reassigned nearly all of our initial assessors to help with the reassessments so that we have as few people as possible experiencing a delay in getting that reassessment completed. We've also
Excuse me, how is that going, what you just said, the reassignments? Have we gotten any results from that?
Mr. Chair, we don't have enough capacity to assign all of the reassessments in a month. So for example, for March, we still have residents whose service span ends at the end of March and their case hasn't been assigned to an assessor yet. We are utilizing overtime to try to reduce that gap, but we just don't have enough capacity.
Okay, thank you.
Within case management, we're also experiencing some significant staffing challenges, particularly with our contracted vendor agencies, and this results in delays in residents receiving their case management. Depending on the waiver type, a resident may wait up to 4 months for their case management assignment. And then once you have your case manager and they work with you to set up the services that are needed based on the assessment, the case manager completes what's called a service agreement, and that needs to be entered by our team into a state system called MMIS. That team is one of the teams that lost some positions recently, and so their wait times, it's taking approximately 8 business days. Before that loss, they were usually able to enter within about 3 business days. I will say we've been utilizing overtime on that team, and that has significantly reduced the wait time. Earlier this year, we were waiting 4 or 5 weeks, so that's down quite significantly.
Excuse me. I have Commissioner May Shang and Commissioner Tara Jevin Singh next. Go ahead, May Shang.
Yes, for the Men Choices annual reassessment with the gaps, do you have a number on how many have faced gaps in coverage?
Mr. Chair, Commissioner Zhang, that's a great question. Our best estimate in this moment is perhaps 20. That is a rough estimate. We're still working to compile the information from each supervisor, but that's what we know as of this morning.
Okay, thank you.
I thank you for providing this detailed historical markers as to how we got to this place, giving us the numbers of staffing and dollars and policy changes. But I just want to take a moment just to reflect on what this means to the individuals who are part of these waits, part of the frustration of this, both as the residents within our communities who are dependent on these services, their families, their caregivers, their providers, but also our staff. And as somebody who has been a provider in community and had to handle trying to advocate for families in these situations, I think having described it as for many families and individuals, the disabilities that they're facing already make life difficult, and handling the stacking of services that allow for a full life to happen is already fairly precarious. And so it's like a house of cards, and when there are these kind of administrative gaps, it shakes the table and it can be really disruptive. And I'm sure it's taken quite a toll on your staff as well as many of the folks who, hopefully all of them, came for the very reason to help these families live and their individuals live their best life. So I just want to take a moment through all of the numbers to acknowledge that, and then just any thoughts that you want to add into this as well.
Mr. Chair, Commissioner Jebin Singh, thank you for that. That's an excellent point. This is really having a significant negative impact on the residents that we serve. Many of us, myself included, went into human services because we wanted to help other people, and this is very painful. This is hard to watch. It's hard to engage in every day, and you're also right, it is taking an impact on our staff, absolutely. This weighs heavily on our staff. It weighs heavily on our leadership. We, every day, receive calls from residents who are rightly frustrated and angry. At times, that results in our staff being treated in ways that we wish they weren't, and that takes a toll for folks. And so I appreciate you lifting that up. We're absolutely experiencing that every day. Thank you.
Garrison?
Thank you, Mr. Chair. 2 quick questions. One, when we're looking at these wait times, are we communicating with residents kind of the expectation, setting an expectation of just how long these wait times currently are? Like, are we having any type of communication to them just so that they are aware that there will be significant waits?
Mr. Chair, Commissioner McMurtry, I'm actually going to call up my staff and have them help me answer this question. Nasser, I'm going to send that one to you. So Nasser Mohammed is the manager over our intake teams and our initial assessment teams, and she's best suited to answer that question.
Mr. Chair, Commissioner, as Katie said, my name is Nasser Mohammed. I oversee the initial intake teams, the reassessment intake team, and initial intake team. So when we get a call from a resident, our intake staff, after taking the referral, they make sure that the family understands the wait time. They also ask questions like, is the person going to a hospital? Is there a risk of nursing facilities? Is there a risk of losing your home? Certain things that we consider in case that we have to shorten that wait time for the families.
Gotcha. And then my second question is, knowing that we've seen such a substantial increase in people needing home and community-based services, what would you say is kind of the basis of why we've seen that increase? And do you foresee these levels continue to go up for the foreseeable future?
Mr. Chair, Commissioner, that's a great question. We have seen an increase. We have seen it statewide, and we see that in the state forecast. One of the primary drivers of the state spending is in long-term services and supports, which is our area. So we are seeing this across the state. I think in part our population is aging, which we had some of the stats on that. I think also, this is anecdotal, but coming out of the COVID-19 pandemic, I think many folks are still recovering from that, and we do see people having higher rates of disability coming out of the pandemic.
My question was very similar. It was just, do we know, because the 18% increase in under 65 is really large, and it was kind of piggybacking off of Commissioner McMurtry's question is, do we know why an 18% increase in people with under 65 with disabilities? Did an expansion in the definition of disabilities change? Or is there other factors such as unemployment, change of income, insurance that is driving this besides what you've already answered?
Mr. Chair, Commissioner Miller, great question. I'm going to call up Brent and have him help me answer this one. So this is Brent Florin. He's the manager over our case management services.
Chair, Commissioner. To some extent, I think it has a lot of different factors. We mentioned COVID as far as having an impact on just the overall health of our community. But we also, and some of this is, we're trying to piece this together, is connected to messaging. I think we've gotten increasingly better at letting the community know. That was a big thing that we were involved in trying to make sure in all the various ways that we can communicate with the community, and I think we kind of did a good job of it. And so, and I think because Min Choices is kind of increasingly known and understood by the community, that in turn kind of gets the numbers increasing. I do also, we have, our state and our county does a good job of taking care of people in general. And we have a lot of folks who come here that we talk to, that I'll talk to on any given day, who say, I moved here from Iowa, I moved here from Mississippi, I moved here from actually many different places. And so we also see an increase of just people, in part because we have people moving to this area for support. So I think that's probably, the numbers we don't know exactly, but like the first portion of that is the highest, I would believe. But we do also, I just talk to people a lot daily, so.
Thank you.
I'll add, some years ago under previous leadership, there was also a recognition that we were underserving racially and ethnically diverse communities and overserving white-bodied members of the community. And so there was a new process put into place. It's called a Rule 185 consultation group, geared for individuals with developmental disability. And it was meant to have more eyes on a case to help reduce bias and make sure that anyone who's eligible is able to access services. And so we have seen an increase in that area. And so that may be a piece of this as well.
Thank you.
And I recognize as I was going through my slides that I didn't talk through how a resident experiences services in our area. So I'm going to back up a few slides. My apologies. So a resident experiencing services in our area will begin by contacting our initial intake team. We take live calls. You can submit a referral online or through fax. Someone can call on your behalf, or it can be the resident. So our intake team, which Nasser spoke about a little bit, is a team of social workers. They will do an initial phone screening. They will provide services, other community resources and services that a resident may be interested in. And as I mentioned earlier, even if it looks like the person will not be eligible, if they want the assessment, then we do put them on the waiting list to receive an assessment. When the assessor gets the case, they'll reach out to the resident and schedule the appointment. They'll go meet the resident at their home or another community setting of their choice, and they'll do a face-to-face interview. That can take 1 or 2 hours, occasionally even longer, depending on the nature of the individual's situation. And then the assessor will do several hours of behind-the-scenes administrative work to complete the assessment. If the individual is eligible for a waiver, that will go to our middle ground team. Middle ground will monitor the case and make sure there's a couple of pieces that you have to be eligible for a waiver. That includes medical assistance and a disability determination, which you can either get through the state medical review team or the Social Security Administration. So sometimes those pieces are not already in place, and so we're very interconnected with financial assistance services and the state medical review team. Those pieces can take some time. When they're in place, the middle ground team will open the waiver and assign it to a case manager, either one of our internal teams or one of the contracted agencies that I mentioned. The case manager will then work with the resident based on the needs identified in their assessment to set up the services that they choose. And that the case manager will do a service agreement that I mentioned earlier. That goes to our waiver management team within the admin and access area, and they enter it into the state system MMIS, and that turns the service on for the resident, and it allows the provider to be reimbursed for the services that they provide. And then annually, the resident needs to have that annual Min Choices assessment, and they work through that process again. So I just wanted to provide that overview so you have a sense of how the resident experience is working with us.
Mr. Chair. Would you walk back to the arrow between the middle ground and the Min Choices assessment about what happens at the state, about obtaining a disability, or what that process is like?
Mr. Chair, Commissioner Zhang, so for nearly all of the waivers, a determination of a disability is required. So an individual may receive that through Social Security. If not, they can access it through the state medical review team. It's called a SMRT. And that team is part of DHS, and they collect a lot of information to be able to make that determination if the individual has a disability. I might lean on my team again. Is there more we can say about the SMRT process?
So, Mr. Chair, Commissioner, when we do an assessment for a family, we will let them know that they need to get certification for disability. At that time, we'll connect them to our financial services area and then the state. So the state will send them documents, and the process takes a little bit longer because they have to get paperwork from their hospital, their doctor to process that. So from the point of the assessment to when we refer them to that state, we're not aware. We just check the system to see if that process was completed. So the state takes over that process.
And what's the time frame for the state? Has it increased also?
Yes. So right now we're seeing wait time up to 6-7 months to get
from the state.
From the state, yes.
Mr. Chair, I just also want to point out that, if that's the case, then there are parts where it's definitely state responsibility, and then there's our part about controlling what we can do, right? So I would actually like us to take a more, I guess, a precise approach about deciphering between those, about our wait times, what we're responsible for, and also the state. And I'm sure that this is something that Maxa probably has brought up already too, right? Or
all counties have been struggling with this for a few years now. It has, I don't know where the state computer system is at, but he had problems with that at one point, I remember.
Mr. Chair, so Maxa does have a systems modernization piece to their legislative platform. I believe that is mostly focused on SSIS, which is the system that our case managers document in, assessors also. To your point, Commissioner Zhang, about the wait times, the wait times I shared in the slides today are our wait times.
Okay.
So a resident may experience additional wait time if they're waiting for the SMRT team.
Oh, right, but it's not like split up, right? Like we don't have a dashboard that says it's at the state. We're waiting for the state to
Correct.
respond.
We don't have a dashboard, correct?
Okay. Yeah, so I was just saying that that's something we should keep track of so that we can also explain to our legislators about like this wait time and the impact on the delivery of the services that we're trying to provide to our residents.
This is, yeah, I mean, you're correct. This is, as you could tell, very complex, and you get two parties involved, the state and the county. The timelines don't exactly follow the same sequence, and I think we have to make a whole list. This is a first blush, especially for this board, to try and start getting a handle on the complexity of this issue. We're going to have to come out with a punch list as to where do we think we could make it, not just for us, but what, as you point out, Mai Chong, what recommendations we have for the state. We have to do something, 7, 6, 7, sometimes more. I deal with constituents who have waited more than 6, 7 months, and it's not necessarily, I'm not pointing fingers, but it's just the interactions and the complexity is, it is a complex issue. And thank you for all your good work. I know you're struggling through all of this, but let me let you continue.
Or can I, Mr. Chair?
Oh, I'm sorry. Go ahead, Mary Jo.
Thank you, Mr. Chair. Yeah, I've started my list of questions. I wasn't going to ask them all, but I do want just some idea of the funding, and maybe you're going to get to this. You know, you mentioned ARPA funding, which was one time only, and now we've got DHS funding, and I know there's been a lot of freezes on funding coming from the federal government. So just curious about the funding for these programs. Are we pretty, I mean, we're already, I'm sure not getting enough of what we need anyway, but are those, is that funding coming through? Are you sure, are we thinking that it's going to keep coming through?
Mr. Chair, Commissioner McGuire, that's a great question.
Yeah.
So the Random Moments revenue, as I mentioned, is a combination of state and federal funds. Right. To date, we are still receiving it. You're absolutely correct with the discussion about changing or cutting Medicaid at the federal level. Right. That could impact us. There's nothing concrete right now. They've put forward, as you know, a number, but there hasn't been any policy attached to it. So what that could look like, we don't know. So at this point, we really feel like we need to address the issues and the challenges that we're experiencing based on current state statute. And you're absolutely right that there could be an impact based on what happens at the federal level.
So we have to watch out for that. Mr. Chair, one more question. I just have a question on the comment that, of course, we take people as they come to us, that we get people from other places. Are these other counties or other states? And do we keep track of where people are coming from if we are experiencing, you know, an increase in people that aren't our county residents, or do we keep track of that?
Mr. Chair, Commissioner McGuire, we do, the resident does have to be a resident of Ramsey County. And I'll maybe let Nasser speak a bit more to that, because that is one of the pieces that the intake team will talk through with the resident.
Mr. Chair, Commissioner, yes, they have to be a resident of Ramsey County, but also there's a DHS policy where a person that lives in Hennepin County, if they're located in our county, for example, if they're in our hospitals or nursing facilities, we are responsible as Ramsey County to do that assessment for them. So there's any given month, a significant number of people. We do have a lot of nursing facilities that we are assessing in Ramsey County.
And just one more question. And so my understanding was, I'm not sure if these are the programs, but I have people that call me and they say, we know we have we have to wait 6 months, but there is a 6-month waiting period for people that do come here from another state or something to get services, or is that not these services? Is that other services? Or is there no waiting period? I thought there was a waiting period.
So for anyone that comes to our intake that is a Ramsey County resident, they have to, based on our timeline, we have 1,947 residents right now in the backlog. So we're right now assigning people from that came to us in July of 2024. So the wait time is a little bit longer. We put them ahead of the line only if they're like exiting a nursing facility or going to a group home or at risk of eviction from their home because they're unable to keep it up. But anyone else is waiting about 6 to 7 months.
Just because we have a wait list or because that's a policy?
No, we have a wait list. The policy, I think, I'm not sure.
I believe it's 60 days to be able to have residency within a county. So if you move, it's 60 days before you'd be
Okay,
that
so
county's
60 days,
financial
not 60 months.
responsibility.
Okay.
I believe that's right. I'm getting head nods. Okay.
Thank you.
So we've undertaken a number of efforts to address the challenges. We revamped our onboarding process. So before this new process, it was onboarding was done by supervisors, so there was a lot of variation, and it was taking 6 months, perhaps longer, for a new employee to be fully trained. So we revamped our onboarding. We now have a 8-week full-time onboarding program so that employees are able to be onboarded within 2 months, and then they move to their team and begin taking cases at that time. And that was done so that we're able to serve more residents more quickly. We've shifted staff to areas of greater need. So you've heard us talk about the challenges, particularly within MnChoices. So over time, we've moved a number of case managers on a voluntary basis over to MnChoices so that we had more staff doing assessments. You've also heard me speak about then the shortages within case management, and so that's a clear connection. We moved case managers to support in MnChoices, but that's contributed to the challenges within case management. I'll note here that our vendors are also seeing pretty high rates of turnover, and so that's been an additional challenge in terms of the case management capacity. We have been working really closely with other counties through MACSA, the Minnesota Association of County Social Service Administrators, and in 2024, we were successful in passing 3 of 4 legislative changes for MnChoices. I'll just tick through those really quickly. The first one was changing the statutory language for from when a resident requests an assessment to when they complete it. The language used to say 20 calendar days, and we were able to change it to be 20 working days. That just provides counties a little bit more time to get to those initial assessments. The initial assessment currently is only valid for 60 days with the option to extend it for another 90. So one of the other pieces that passed last year was to make the initial assessment valid for 365 days, and that change will take effect this July 1st. The third piece, which was really valuable for our county, this language was changed so that counties who contract out PCA-only reassessments are allowed to continue to do that while we work with DHS on a plan to roll those assessments into the MnChoices tool. For Ramsey County, we're one of 5 counties that contract out those PCA-only reassessments, and for us, that's between 4,100 and 45 reassessments annually. So it's really helpful to us to be able to continue to utilize that option. We have also increased caseloads for both assessors and case managers. And part of that is connected to the new revised MnChoices tool is designed to be quicker, saving the assessor some time. And we also have a little bit more flexibility to do some assessments remotely, saving travel time. We've also been working through some process and procedure efficiencies. As we've talked about, our area was, from the board, received some funding through ARPA for limited duration assessors, and they've helped us to complete. I think in the ARPA board workshop, we shared over 2,000 assessments have been done through our ARPA-funded staff, so we're really grateful to have them. We've been also using staff overtime. We did a request for proposal for additional case management vendors that closed just last week, so we'll be working through that process. We had a robust response, so we're looking forward to partnering with more agencies. We continue to work closely with counties and MACSA on some additional legislative changes. One of those that we're working hard on for this session is a shortened or a streamlined reassessment for individuals whose needs haven't changed. We hear from residents that they don't want to have to go through that process every year, and it would also allow us to spend more time with folks who are waiting for their initial assessment. We continue to problem solve in partnership with DHS and MACSA and other counties. As I've mentioned, other counties are also struggling. Need is up statewide, especially within the Twin Cities metro, and so we're working closely with other counties to try to find policy or other process changes that could be made to make things more efficient. So we're grateful for those partnerships. We are also exploring artificial intelligence and other technologies that could further enhance our efficiencies. So while we are struggling, other counties, we're not alone. Other counties, as I mentioned, are also experiencing some increased need as well. So we continue to collaborate, as I mentioned. So in addition to the work together on policy change and pursuing legislative changes, other counties have also been able to hire some additional positions. So Hennepin County, within their past couple of budget cycles, has been able to add 70 positions. Dakota County added 29 positions for 2025, and Anoka County has increased positions by 19 from 2021 to 2025. The good news here is that we do have a proposed solution for you. We are seeking 80 new full-time equivalent positions. This would include 61 supervisors, 5 case managers, a social worker for our CFSS team, 9 support staff, and 4 supervisors. This will allow us to begin addressing backlogs across the division. Once new employees are up and running, we would have an additional assessment capacity for initial assessments of up to 180 more cases per month. This would add to our reassessment capacity by 525 cases per month. Providing additional case management to 250 more residents. It would add capacity on our waiver management team to complete more service agreements. That's the piece that turns services on for residents, by about 200 service agreements more per month. And it would add capacity to our CFSS team. One of the pieces with CFSS is that a lead agency social worker has to approve support plans. So the resident has an assessment, they have to work with an outside consultation provider. That plan comes in and we have to approve it, and that has to be done by a social worker.
Excuse me, Tom?
Yeah, I just wanted to ask how we came to the 80 FTEs as the suggested amount to add to the staffing level.
Mr. Chair, Commissioner Jebin Singh, we looked at where our backlogs are across the division, caseloads, what we can assign every month, what we see coming in so far this year, and then we used that. We worked closely with our fiscal partners to figure out how many positions we would need and how that would allow us to address the backlog. So with these positions, we project that we would be able to clear the backlogs by the middle of 2026.
And then a follow-up question would be is if these 80 positions do help with the backlog, do you think that they would be needed going forward, given the slowest moving demographic train ever, where we knew starting decades ago that we would have growing needs as we come into this time in our history. So just wondering where we think these 80 FTEs as far as addressing this current need, but then also projecting forward.
Mr. Chair, Commissioner, yes, we anticipate needing the additional positions long term. We continue to see a higher number of calls coming into our initial intake team. We're receiving perhaps over 100 a week, over 500 a month, which is much higher than it had been a few years ago. As you mentioned, the demographic is also aging, and so we anticipate continuing to see residents over 65 needing services. The other piece that is important here is, you heard me mention earlier, at some point we do need to roll in the PCA-only reassessments that are done by our contracted agencies. So there's about 4,500 assessments that will need to come into our system at some point in the coming years. Again, working with DHS on that timeline.
Garrison?
Really quick question. On average, what is the reasonable number of cases that any given assessor should expect to take on?
Mr. Chair, Commissioner McMurtry, currently we're assigning 13 cases for initial assessors and 15 cases per month for an assessor doing reassessments. At this time, given the work that is needed and the time, we don't anticipate being able to go above that.
What would be the ideal?
I think Mr. Chair, Commissioner Jebin Singh, I think our staff would prefer to be able to go back. We had been assigning 13 cases to our reassessors. I've been moving around to all the teams this year, and I am hearing feedback that between the reassessments and the CFSS rollout, there would be a preference to be able to go back down to 13 or 14 reassessments in a month.
So just so I'm understanding, what's the current average of their caseloads?
Mr. Chair, Commissioner McMurtry, they're assigned 15. The reassessors are assigned 15 cases per month. And sometimes those aren't necessarily always completed. Sometimes the resident will begin the process and decline to continue. But the assessor is assigned 15 cases for a reassessment. Initials is 13.
Rena?
Thank you, Mr. Chair. I'm going back to some of the challenges. So currently is MCASA, right, leading efforts at the legislature to make these additional men choices changes that are needed. So they're actively lobbying at the Capitol right now for the changes? Or do you know?
Mr. Chair, Commissioner Moran, thank you for the question. Yes, MAXA it's on their legislative priority list for a streamlined reassessment for min choices. So that is something that they're actively working on. I believe it's accurate to say that they have a bill that is to the revisor's office for a jacket. So I'm one of the folks from the counties that's involved, and we meet every other week to talk through how we're going to try to move that work forward. So that is one of the priorities for MAXA this legislative session.
Okay. And I was just thinking, you know, for myself, and I don't know if we need to do anything, but we have Commissioner McGuire and myself who are chair and vice chair of our legislative agenda. So if there's any way that we can be helpful in this effort to please share and let us know what that looks like.
I will take you up on that, Commissioner Moran. Thank you very much.
Kelly?
Just very quickly, our assessors they do both. They do both the new assessments coming in and the reassessments, or are some assessors only doing reassessments and some only doing new requests?
Mr. Chair, Commissioner Miller, typically we have a group of assessors who do initial assessments and then a group that do reassessments. That's just because they're more familiar, they can move a little bit quicker. In times like these, we have initial assessors completing reassessments to help us get as many of those done in a month as possible. So they are and can be cross-trained to help do different types. Ideally, if we had staffing to meet current need, we would have initial assessors do those types every month and then have the reassessors do the reassessments every month.
And then just a quick follow-up, with the additional 80 new FTEs, will it go back to that model?
Mr. Chair, Commissioner Miller, that is our goal.
Okay.
Yes. And in part because, as you see the wait lists in initial assessments, those backlogs are really growing exponentially, and we want to begin to serve those residents much quicker.
Thank you.
Mike Chong?
You know, this reminds me of a case that came across my office as well, too, about just serving our residents with language barriers. As we are hiring additional folks, will there be any sort of emphasis or recruitment efforts for folks who speak a second language that would serve Ramsey County residents?
Mr. Chair, Commissioner Zhang, yes. One of the things that we did when we revamped our onboarding and hiring was to do hiring through a racial equity lens. So we changed everything we could about the hiring process. So our leaders hire in teams. Our goal is to have those teams be racially and ethnically diverse. We changed up the interview questions that we ask, and we also sort of expanded the lens of what we think about who makes a good candidate or a good employee, and we really looked not so much as have they done an assessment before, do they know the state system, do they have a passion for the work, do they have lived experience, how can they add a new additional perspective to our team. So yes, that is a significant point of focus for us.
Okay. Yeah, I would say like the language piece would be really crucial here because, you know, what I just learned in the case that my constituent told me is that, you know, for adults who become disabled, who are under the age of 65, if they need PCA services and they can't afford they can't afford their health care or like the PCA services, it gets put on their assets as a lien. So in this situation, even though the spouse who was receiving PCA services passed, there's a lien on his house that that the widow has now. Yeah, and so she doesn't even own the home at all. And I think that's a big, broader question for us about then how does one even obtain or generational wealth in this case, and what happens to her, to the surviving family members.
Rena?
I was going to ask these questions, but then I read through the presentation, because as we talk about additional 80 FTEs, I wanted to hear more about how we're going to pay for it and where we found the dollars to do that.
And I'm gonna make a,
Keep going.
I'm gonna raise a question. I don't necessarily expect you to answer it, but we're concerned about the mechanics and all the issues we've been dealing with. And there are concerns about the funding. And it's given, after coming from Washington and talking with folks, I'm also concerned about the eligibility side. Could the federal government say this group of people are no longer eligible, which is a whole different story, right? Because now we know there are people that need service. And it isn't even a matter of dollars, but it's a matter that they're not eligible. So I'm not, I don't know if you have any comments on that, if you thought, I'm not expecting, I don't know the answer myself. I've just been thinking that we focus a lot on the funding piece, but we also got, at the federal level, sort of start considering the eligibility piece.
Mr. Chair, yeah, thank you for lifting that up. We worry about that also. As you mentioned, we're seeing folks needing services at a higher rate, and we want to be able to provide services. We're residents first. We got into the field to help folks, and that's what we want to do. So that is worrisome. We're watching that very closely. We've been in partnership with government relations to track that as best we can and to advocate as best we can. It is worrisome, absolutely.
Yeah, I appreciate it. It just means it keeps getting more complex, right? So we got to work together on this. Yeah, I like to make an announcement. I know I'm going to get feedback here, but I am going to, outside board and committee reports, I'm going to postpone it till next week. We'll give you extra time next week. County manager, you got 2 minutes to give your reports when it comes, because we want to get to your celebration, because we do have a closed meeting at 12 o'clock, and we still got to get through HRA. So,
Are we done?
She's got a couple more slides.
No, I'm just sort of giving you a heads up on how we're going. Go ahead.
I'll move swiftly. So to your point, Commissioner Moran, we do have some financial information that we can share about the additional positions. The total cost of the 80 additional FTEs for 2025 is just under $6 million. Based on our random moment data and the waiver case management data for the revenue that we generate, we will receive about $4.9 million of that, which offsets 82% of the total cost. That leaves total one-time startup costs of just over $1 million. Our health and wellness leadership has been working closely with County Manager Becker and Finance to secure the funding for this initiative. The one-time costs for 2025 will be funded through county-wide funding sources within the County Manager's office and the Health and Wellness Service Team budget for 2025. Thank you, County Manager Becker. So there's no additional levy needed, and the Finance and the Health and Wellness Team will be monitoring this closely and are happy to report back as requested. Ongoing costs will be included in the 26-27 proposed operating budget. And as mentioned, there'll be a request for board action next Tuesday, March 18th, to seek your approval for these positions and the funding. I'll speak briefly just about how we might go about hiring and onboarding such a large number of FTEs. Based on our experience filling the ARPA-funded positions, we have developed a hiring and an onboarding cohort model, which I've mentioned a little bit here already this morning. So we would have 56 new employees who would go through our onboarding training cohort. Those are assessors and case managers and the CFSS social worker. That is an 8-week full-time program where they receive foundational training, including their MnChoices certification. That planning is already underway. We've been collaborating with Human Resources and starting to put kind of behind-the-scenes pieces in place so that we can move as quickly as possible. Our goal is to hire up to 20 positions to start on a May 27th cohort. 24 of the 80 positions would be able to be hired and trained outside of that onboarding cohort. That's the supervisory positions and the support staff who were able to onboard more quickly. And we can run those parallel to the cohorts, and we will be trying to hire those folks within quarters 2 and 3 of this year, so April through September. Our onboarding, as I mentioned, we have folks, so the The interviews are done together. Supervisors partner to move through that interview process. That helps us move a little bit quicker. So we have new employees starting together on the same day, and then they go through 8 weeks of training together, building kind of a new employee community, and then also getting onboarded quickly. They move to their teams after the 8 weeks, and their supervisor takes over, shadowing and providing coaching and mentoring to help new employees be supported. We've outlined some tentative onboarding start dates. Our goal will be to try to get folks in 2025. We've also planned some cohorts in 2026 in case we aren't able to get everyone hired in 2025. So our next step is a request for board action next Tuesday, March 18th, to seek approval for the 80 additional FTEs and the related funding. Again, I want to thank you for your time this morning, and I'm happy to answer any additional questions.
I have a question about the funding sources with the county-wide funding sources within the county manager office and the health and wellness service team. Where does that saving come from?
Madam Chair, or Mr. Chair, Commissioner Zhang, I can address that. So as part of our budget, we have money allocated every year under what's called the Residents First program. You've gotten several presentations about various projects that that fund has sort of supported. Those things include enterprise services, technology, resident relationship management, financial assistance services, case management, the Maplewood Service Center redesign. So we've kind of have this fund for that departments can go and ask for Residents First funding. And so right now I've put a temporary pause on the Residents First projects that had typically gone through that, that avenue, and instead focus that on these AHOD efforts. And so there's $1 million there to be able to do this one time so that we can proactively get ahead of this backlog and then hopefully be able to capture the random moments for the ongoing sustainability of these positions.
Okay, thank you.
Yep.
Rena?
Thank you for your presentation. So I think this has been like a long time coming. We have all been hearing from our constituents about the delay, the frustration, the backlog, because we know when people come to Ramsey County, they are coming at their most vulnerable state, and they're asking for help and they're asking for support. And then what happens is staff is confronted, right? And they're being yelled at, they're hearing all the negative stuff, right, that comes from residents. And I know as a county, we work hard and try hard to be efficient and effective and, and serve the people without ever turning away anyone from services. But it has been a journey in trying to get, whether it's state, federal, whether it's just a couple of a lot of things that's happening. The lack of staff overwhelmed, staff leaving, cannot, just been frustrated. So I am happy to be a part of a presentation where we openly talk about the challenges, right? And not step away from allowing the board to know that there are challenges that the county is facing in order to find some resolutions around how we can move forward. I want to thank our county manager, Lynn Becker, for this all hands on deck, because I think sometimes when we do a deep dive, we begin to find other spaces where we can do this work and be more efficient, more effective in responding to the demands of the community. We looked at the request to hire 80 more staff. We probably need more than that, but we'll take the 80, and I know you would take the 80. And even within this deep dive that you have, I love solutions, right? Because we can talk about all the challenges forever and a day, but until we come to solutions to make people's lives better, we're just scrambling, right? And we can't live in that world because we are a county that is here to serve and to advance and help people to be self-sufficient, all the things that we want, right? So that they don't have to depend on the county, but sometimes they just do. And so Here we are where we have found almost close to $6 million that it's going to take to do this work. And we are able to do that because you come before us addressing the challenges that we've had, but also bringing forth the hard work of bringing teams together to get to this place where we are. This is way overdue. This is way overdue. And so I am just really, really happy that we have gotten to this place that, you know, we can say we found the dollars. It is not going to cost the residents of Ramsey County another penny on the levy. That is awesome. Not enough, right? That is just awesome, awesome work. And so I just wanted to just share that because it's important that we just lift that up and allow the public to know that and to know that we're working real hard on solutions, that we hear their pain, we see the pain, and we also are searching for a solution, and it takes time, right? I just wanted to share as we was lobbying in D.C. recently, where the board members was lobbying our congressional leaders, recognizing that right now we have Medicaid and SNAP and our HUB grants that are all in jeopardy at this moment. And we know that Medicaid provides health coverage for almost 80 million low-income Americans around this country, right? And that Ramsey County in 2023, $2.9 billion in total Medicaid costs that came here. If we lose those dollars, it's going to have a huge impact on real people's lives, right? Babies, mothers, children, our elders. And so let's just keep working and digging down in these challenges that we have, right? And do the hard work of, you know, it's hard to tell people that these are the challenges that we're having here, right? But it's okay, because if we don't do that, we can't get to the solutions too, and find out how, as a county, we can do our work more efficiently and effectively, and at the same time, keep the levy down, keep it flat a little bit. So I just want to thank you for your presentation today and laying it out for us, because our constituency has been speaking to us and calling us and complaining, and so I hope they hear that, you know, it takes time, but work is on the way. The solution is on the way.
Garrison?
Real quick, thank you, Mr. Chair. On the revenue side of things, when you mentioned that some of the money that's going to be used to pay for these new FTEs will come from the random moment and the waiver case, is this the first time that we're leveraging those revenue funds to pay for FTEs? And if so, are we taking away money from other areas that this pot of money has been used for, or is this is it not going to have like an impact in other areas that maybe you've used that money for in the past?
Mr. Chair, Commissioner McMurtry, great question. We have been generating that revenue over the past years. That is one of the main funding sources for our area that supports our division's budget. So we won't, I'm not aware, I'm looking at our fiscal partners, I'm not aware that we would be pulling revenue from other areas.
Tara, you have a 30-second announcement.
Okay, thank you all. In light of not having our community shout outs, I did want to recognize, following on Commissioner Moran's wonderful job of lifting up African American History Month, to recognize that it is Women's History Month, and to lift up Nellie Griswold Francis, who was born November 7th, 1874 in Nashville, Tennessee, was a pioneering figure and a steadfast advocate for women's rights, significantly contributing to the educational system and the suffragette movement. After moving to St. Paul's Rondo neighborhood, Nellie spent her early years in Minnesota attending the Madison School, joining Pilgrim Baptist Church, and providing musical entertainment for the Hotel Chautauqua guests in White Bear Lake. It was then through the church that Nellie first spoke about women's suffrage, which ignited her lifelong activism. Nellie delivered powerful speeches on women's rights. She became a member of key Black organizations such as the National Afro-American Council, and in 1914, she founded the Every Woman Suffrage Club for African American women in Minnesota. Through these efforts, Nellie protested at the 34th Minnesota State Suffrage Convention and became a delegate at subsequent conventions. The Every Woman Suffrage Club also grew to include over 50 members, and through their advocacy, she met prominent figures like Hallie Q. Brown, W.E. Du Bois, and Booker T. Washington. Overall, her efforts helped Minnesota become the 15th state to ratify the 19th Amendment in 1919, which paved the way for a national suffrage victory in 1920. Securing voting rights for all women, regardless of race or background. In Nellie's words, "Your children will reap the harvest of our solidarity." I am honored and grateful to be part of this Ramsey County Board, which is a result of the suffragettes and civil rights workers who fought and sacrificed to make this board possible.
Thank you.
Thank you.
You did a good job.
Well, before you adjourn, we have to make one, are you going to make an announcement about the election today?
I
mean,
am.
just
I
wanna
was,
say, okay,
yes.
you're going to, yeah, good. I didn't know how
Yeah,
much, I didn't know how much you were going to let us say.
Yeah, I just have one update, Commissioners. Today is Election Day, as Director Tracy West also mentioned, but we have a special election happening for the Minnesota House of Representatives, District 40B, which primarily includes the communities of Roseville and Shoreview. All polling places are open today from 7 a.m. to 8 p.m. Results will be posted on the Minnesota Secretary of State website. We'll post a link to the state's website under our results. Voters should go to minnesotavotes.gov to confirm their voting places. The county will actually canvass the results of the special election tomorrow at 1 p.m., and the state will canvass it on the following day. So if a recount is needed, it would occur the following week, but that would be determined by the state. So I look forward to, I've been hanging out at elections quite a bit this year under special elections, but I will once again be hanging out with the team tonight for a little bit. So thank you for all their work. They are just a tremendous team, so.
Thank you. Okay, next we have an HRA meeting. We'll take a quick 5-minute break, then have our group photo, then run down to the celebration.